Thank you all. Great opening remarks. Okay, now we'll start with Brogan. We'll take the first question as well. Mr. Brogan, mental health supports for veterans, first responders, and others who are suffering PTSD and related illnesses are difficult to access. How will you support those who serve our society?
Thank you for the question. We definitely need to have more supports for mental health, particularly for those who are involved in employment areas that are very stressful and that are interpersonally stressful. They're emotionally difficult jobs that those people do, and those are valuable jobs. We want those people to be functional so that they can respond to us in times of crisis. The Green Party would put forward a mental health strategy. So we need to evaluate what is available now, and we need to make sure that the services are available for our veterans, for our first responders, yes, sorry. Just to make sure that they're fully functional human beings and continue to do their good work.
Thank you, Brogan. Matthew?
Could you just repeat that again?
Sure. Mental health supports for veterans, first responders, and others who are suffering PTSD and related illnesses are difficult to access. How will you support those who serve our society?
Well, first of all, I can experience what it's like to try and get mental health support. I quit alcohol in 2015, and I've been clean since June 11th, and I know it was 2 months before I saw anything. Thank you so much. As far as goes for veterans, I'll quickly read up what we can do because I think it's important to bring that across. We will recognize the unique sacrifices of those who serve and have served in Canada's armed forces, and we will enshrine in legislation the country's obligations to our veterans in a military covenant between the government and those who serve. We would reinstate the bare disability pension as previously provided in the Pension Act. The pension will apply retroactively up to 2006, and lump sum payments received will then be treated as advance payments. And we would instigate a line-by-line review of the new Veterans Charter, including enhanced new Veterans Charter Act of 2011, to determine which policies and programs should be retained. So there is definitely a need for mental health support in our community, and especially for those going to lay the leg on the line, and I thank you very much.
This is a question I think that I have a little bit of knowledge on, and I want to thank our first responders that are here in the audience tonight. My husband was 30 years with the local volunteer firefighting fire department, and he suffered with PTSD as well. I met, through this process, I met with a local psychiatrist who has clinics in Halifax, and he talked about the amount of bureaucracy that is involved in the government-run clinics for vets. And isn't it a shame that there wasn't a clinic in a place like Cape Breton that could have saved the lives of the family, that the poor veteran who suffered with PTSD affected. He is able to see twice as many patients than the government-run agency, and would like to be able to be given the chance to do it in other places as well. We would support that action.
Thank you.
I certainly echo what Martha said, congratulating and acknowledging the incredible work that our military, our veterans, and our first responders. My wife was an ex-RCMP member for 10 years, and she suffered from PTSD, not necessarily from her job, but the incredible amount of harassment she actually experienced within the RCMP. So one thing we would do is change the culture of some of these agencies, the RCMP, the military, so that we don't have the harassment, we don't have the kind of unnecessary stress that is inflicted on a lot of our first responders and veterans. And Peter Stauffer was a great advocate of veterans. I want to be that for veterans, and I want to be that for criminal justice professionals as well, because I work within the system. And the point I want to emphasize is the importance of prevention. I work with at-risk kids and youth in mental health care, and we do work to help prevent mental illness from coming up, which includes curriculum, structured cognitive behavioral curriculum that helps prevent anxiety by nurturing coping skills. So we need a more preventive approach to prevent these issues from arising.
This one for me too is close to home. My aunt served in the military for 33 years and actually retired on a disability pension. So again, I'll echo the comments of my fellow candidates. For those that have served, we appreciate your service. I just want to highlight some of the work that's been done in the last 4 years. Mental health specifically, there's been an additional $300 million provided by the Liberal government in the last 4 years to support provinces on this side. $10.25 billion towards supporting veterans. That's what's happened in the last 4 years. There's been a return of the Veterans Affairs Centers that were taken away under the Conservative government. And also there's been an increase of the income supplement from 75% up to 90% of the pre-release salary for veterans. We know that they're important, we're doing the work, and certainly my role moving forward will be to work with veterans here in Kings-Hants. And as part of our Liberal platform, we've also sought to work to reduce the bureaucracy for veterans seeking to receive benefit. Thank you.
Okay, Matthew, we're going to start with you for this next one. What does a national Pharmacare program look like for your party, and how do you plan to make it affordable?
It doesn't exist within our party. We would much prefer using the free market to leverage these things. So we don't have any intentions to do any overall universal health care or some standard quality of life payment or some grossly high minimum wage. We see each one of those things as actually increasing the cost of living, whereas we'd actually like to decrease it and to help out the Canadians instead of doing this perpetual pushing along of the buck to the next generation. Thank you.
Thank you again. I witnessed firsthand the importance of reliable health care when my husband Brian was sick and with cancer. He was prescribed oral chemotherapy. We were told for his type of cancer, traditional chemo was not effective. However, oral chemo is not automatically covered by our Pharmacare program, and the cost is exorbitant. At that time, he was facing a life and death situation, and we were forced to make special application and then wait and see if he would be approved. This is an added stress that no family should have to endure at this time of their lives. We've seen for years the Liberals have been promising Pharmacare program for decades, and have done absolutely nothing about it. There's no reason to believe this time will be any different. They will have to drastically rise taxes in order to implement what the Hoskins report recommends.
Thank you very much. The NDP is proposing a national Pharmacare program that we like to call it our head-to-toe coverage. That includes also expanding dental care, universal health care, and mental health as well. We estimate that the Pharmacare program will save families up to $500 a month at minimum. And we know that this is a really incredible program. We're one of the few developed countries with universal health care that doesn't have a Pharmacare program. And it's certainly one of the more popular policy platforms we have by judging the reaction from people at the door. But the problem is we have certainly people on social assistance gets coverage, people that have jobs with unions or other Medicare coverage, but there's a large proportion of people in the middle class, the working poor, that don't have coverage through their union or their job and don't qualify for social assistance, who fall through the cracks. So we're very proud of this. This is one of our signature platforms, and we'll be implementing this as soon as we form government.
Healthcare is one of the number one issues I hear on the doorsteps when I've been throughout the communities here in Kings-Hants, and our Liberal government recognizes the importance. Of course, it's not a federal responsibility, but we have a role to play in working with the provinces, and there's been a 4.1% increase in health transfers to the provinces. In fact, there's been more money allocated to Nova Scotia in the last 4 years than ever before. As it relates to National Pharmacare, as part of our platform, we are seeking to introduce a new National Pharmacare plan. It would be working with the provinces and territories because, of course, the constitutional nature of healthcare being administered at the provincial level, to work with them to make sure that people that don't have coverage have access to Pharmacare moving forward.
The Green Party supports a national pharmacare program. We wouldn't have to form government in order to push for it because we would work with other parties who also believe in this as part of their platform. It's important that there be universal access so that it's not just picking up the pieces from people who aren't covered currently. It would have to cover everyone, and it would be a single buyer system. So the Canadian government would be negotiating the drug prices. A lot of people don't know that Canada pays more for drugs than a lot of other OECD countries because the prices are not negotiated in a bulk form, they're negotiated pharmacy by pharmacy. It's really important that we have a Pharmacare program. People are choosing between eating and getting their medications, and that means sicker people, it means more costs to our system as a whole. And Pharmacare drugs are the fastest growing expense in our healthcare system. So we need to get a handle on it, and Pharmacare is one way we can do that.